After neck surgery, especially an ACDF, which is a neck fusion, most people expect some soreness, stiffness, and healing time. But one thing patients might not always hear about is a rare complication called C5 palsy. Now, C5 palsy is weakness that can develop in the shoulder or upper arm after cervical spine surgery. The muscles most commonly affected are the deltoid, which is at the side, which helps lift your arm out to the side, and the bicep, which helps to bend your elbow. Now, this can happen right after surgery or sometimes a few days later. It is not too common, but it is important to recognize this. Patients might notice that their shoulder suddenly feels weak. They might have trouble lifting the arm. They might feel like the arm just doesn't respond the way it should. Sometimes there might also be some numbness, tingling, or pain around the shoulder and the upper arm. So why does this happen? Well, there's a few possible reasons. The C5 nerve root might become irritated, stretched, or compressed during or after surgery. There can also be swelling around the surgical area that affects the nerves as the body heals. The important thing is not to ignore new weakness. Pain and stiffness after surgery can be expected, but new shoulder or arm weakness should always be reported to your surgeon. The good news is that many people do recover, but recovery can take time. This is where physical therapy can play an important role. Rehab might include gentle range of motion, carefully progressed strengthening for the shoulder and the biceps, posture work, nerve-friendly movement, and regular reassessments to make sure that strength is actually improving. The goal is not to rush the nerve. The goal is to protect the healing process, maintain motion, prevent compensation, and gradually rebuild strength as the nerve recovers. So here's the big takeaway. C5 palsy after ACDF, again, neck fusion, is uncommon, but awareness matters. If you recently had neck surgery and you notice new weakness in lifting your arm or bending your elbow, don't brush it off. Contact your surgeon and get properly evaluated. And once you're cleared, the right rehab plan can help guide your recovery safely and effectively. If you've recently had an ACDF surgery or you're concerned about post-surgical shoulder weakness, give us a call or send us a message to schedule a free post-surgery movement check.